Hi, I'm Peter Lawrence, editor of the Journal of Vascular Surgery. I'd like to tell you about the October issue of the JVS, which has an outstanding lineup of papers. One of the highlights of this issue is the Homans lecture, given at the SVS meeting by Dr. Frank Veith. Dr. Veith has been a very accurate prognosticator about the future of vascular disease management and the role of vascular surgeons in its management. In his Homans lecture, he discusses the evolution of the field of vascular surgery, why open vascular surgery has shifted to endovascular, and the enduring but small role of open vascular surgery, and what it is that makes vascular surgeons different from other specialties that manage vascular disease. The editor's choice, abdominal aortic aneurysm repair in octogenarians, is associated with a higher mortality compared to non-octogenarians. It is by Hicks and colleagues from Johns Hopkins and reports on the outcomes of 21,900 patients entered into the VQI database who underwent AAA repair from the years of 2002 to 2012. The study includes both endovascular and open repair and reports a significantly increased mortality with either EVAR or open repair in octogenarians after correction for comorbidities. Another paper by Baker and co-authors from Tucson and Albuquerque is entitled Analysis of Endovascular Therapy for Femoral Popliteal Disease with the Supera Stent. The authors report on this recently FDA-approved stent, which uses a woven tube construction to improve flexibility and reduce compression in areas such as behind the knee. Their results are short-term and an average of 1 year, with an excellent primary and primary-assisted patency. Unfortunately, the authors did not report on an important objective measure, the ankle brachial index. But we eagerly await their long-term results at 2 to 3 years, a time when many stents fail, as well as more accurate physiologic studies. The next paper, Anatomic Features in the Distal Aortic Arch that Influence Endovascular Repair, by Sweet et al., studies aortic arch anatomy and gantry angle in assessing the proposed seal zone of thoracic endografts. They found that preoperative planning for zone 2 and 3 proximal fixation requires precise calculations, and that at 20 degrees gantry angle correction, substantial loss of proposed seal zone can be expected. Another paper, High Proportion of Known Abdominal Aortic Aneurysm in Patients with Ruptures Indicates Surveillance Deficiency, by Zomarati and et al., conducted in a single geographic region in Sweden, examines all 283 patients admitted with ruptured aneurysms over 4 years. 30% of the ruptured aneurysms had a previously diagnosed aneurysm. The two most common reasons for not repairing the aneurysm were the surgeon's assessment of risk and poor patient compliance with follow-up. They recommend a better follow-up system in patients with known aortic aneurysms to reduce the high mortality related to subsequent rupture. The last highlighted paper is Autonomic Outcome is Better After Endarterectomy Than Stenting in Patients with Asymptomatic Carotid Stenosis, by Ruprecht and co-authors from Germany. They assess baroreceptor and chemoreceptor function in patients with asymptomatic carotid stenosis before and after carotid endarterectomy and carotid stenting, and found better autonomic function after endarterectomy. This was due to a restoration of the chemoreceptor, but not baroreceptor function. This better autonomic function may lead to better long-term cardiovascular outcomes after CEA. This is just a sampling of the many excellent papers in the October issue of the JVS, which we hope you have the opportunity to read. Thank you.